OCR Cambridge Technicals in Health and Social Care. This is Level 3 Extended Certificate or Diploma, Learning Outcome 1, PowerPoint 1. Here is the grading criteria for Unit 1. This PowerPoint will focus on Learning Outcome 1, in particular looking at the content for P1 and M1. There is PowerPoint 2 and 3 to follow this. Learning Outcome 1, Understanding Relationships in Health, Social Care or Childcare. For this assignment, you'll be expected to cover at least 2 different environments and consider and explain the range of relationships that can be built in health and social care and childcare environments, including with other members of staff, senior management, individuals that require care and support, and their families and advocates. For M1, learners will need to understand how contexts such as a one-to-one interaction, being in an individual's own home or informal situations can affect relationships. First of all, we're going to have a look at some of the health and social care settings. Here are some of the local health and social care settings to us. For example, the local doctor's surgery, our school, and East Surrey Hospital. Examples of health and social care settings are nursery, play school, childminder's own home, hospital, clinic, doctor's surgery, opticians, chemist, school, a home, and an ambulance. Task 1, relationships. I want you to consider the health and social care settings on the previous slide, and then I want you to write down as many relationships that can occur in those settings. Once you've done that, you may pass them on to your teacher. Keywords throughout this PowerPoint will be positive relationships, health environment, such as a hospital or GP surgery, social care environment, such as an old people's care home, childcare environment, such as a nursery, working in partnership, and advocates. Types of relationships. Most types of relationships that you will come across are mainly between you and the service user. For example, a patient. It is really important to be able to build positive relationships with the people that you are working for and supporting. All work in health and social care will involve working with or together with people who are vulnerable, at risk of harm or in need of support. For example, recovering from a hip operation in hospital. Other examples can include requiring support to live independently because of mental health needs, or requiring support whilst living with a foster family. For the purpose of this assignment, we'll be focusing on 3 main environments. There is the health environment, so practitioners and organisations that provide diagnostic, preventative, remedial and therapeutic services in different settings like a hospital or a GP surgery. Then we have our social care environments. So this is a professional organisation that can provide care, support, protection to young people, children at risk, and also the elderly. Basically anybody that is who is considered vulnerable. Childcare environments is an example is a nursery or a preschool, and they're practitioners and organisations that work with children from birth to 13 years old. Positive relationships are vital in providing high quality care. So it's important that you work effectively in partnership with those around you. In health and social care and childcare, it's important that you work well with people that you work with, so your colleagues, and people that you care for, so service users. It's important to build positive working relationships between individuals, carers and professionals. The people you are caring for should remain at the centre of any care that is provided. Good quality care and support is developed through mutual respect and open and honest communication. To provide care that is high quality, it's important that all care professionals are consistent in their approach to working with service users. So here are some qualities that are important when working in health and social care and childcare. Number 1, you should be caring, approachable, so people should be able to come to you should they have a problem or a query. You should be reliable, people must know that you are there for them when they need you. Emphatic, so making sure that you are there to listen to them and their needs. You're respectful, so you treat everybody respectfully. You're polite, you're friendly, you're supportive is another one, making sure you're there to give them any advice and help that they require. it's actually quite an easy one to remember. So caring, approachable, reliable, emphatic, respectful and supportive. It's a way of remembering it. It's using the acronym CARERS. Right, we now have task 2, which is advocate. An advocate is someone that speaks on behalf of somebody that cannot represent themselves, or they cannot speak for themselves. They represent, an advocate represents their views, needs, and interests. An advocate can be a family member or a relative or a friend, and it can also be someone that volunteers to do that role. I want you to stop the PowerPoint now, and I want you to list down some of the reasons that an advocate could be required to speak on somebody else's behalf. So jot these down, and then you can go through them with your teacher. Expanding on what I said earlier, that advocates can be family members, friends. They can also be provided through an advocacy service, such as a charity. Family can be your brothers, sisters, aunts, uncles, grandparents. Somebody that knows them well and will be able to ensure that their views, opinions and preferences are put forward. Advocates may work closely with the individual well, or others who know them well. When considering what makes a good advocate, it's important to realise that they should be independent. They're able to help individuals understand their rights. They're able to help individuals express their views. They are able to help individuals get information. They're able to help individuals with getting involved in decisions about their lives. And they're able to help individuals explore different options. At no point is an advocate about the person who is talking on behalf of the person that can't. So it should all be about the actual service user. The person that's acting as an advocate should have no say in what's being suggested or said. It is down to the person they're representing. Their opinions, the person they're representing, his opinions are the most important. They are the ones that they should be conveying. So now we move on to key terms. We have supervision, mentoring, psychologists, psychiatrists, and allied healthcare professionals. If you stop the PowerPoint now, you can quickly research via Google what each of these mean. Colleagues and peers. Colleagues are people that you work with. All health and social care and childcare environment settings will consist of people that work in teams. This can include colleagues that work in the same job role or same level, and these people are sometimes called peers. In these relationships, an element of friendship, peer mentoring and support can often develop through the sharing of similar roles and working closely together. Senior workers and managers. The relationship that you have with your senior worker or a manager or your line manager may be different to that you have with your colleagues. As senior workers are considered higher up than you, it may be that you might not approach them in the same way that you approach a colleague that you've worked with for about 20 years. Senior workers and managers in health and social care and childcare have an important role in playing to play managing and leading teams of professionals. They will have responsibilities overseeing the day-to-day running of the services that provide individuals with care and support, for example, a cardiology ward in a hospital. They should also support their teams of professionals through supervision and mentoring. Going back to your research a few slides back, you may wish to see whether these were correct. Supervision is a process in which more experienced workers monitor and support their colleagues to improve their working practices. Mentoring is a process where one person, such as a manager, transfers their knowledge and experience to another person to enable them to develop their skills and improve their performance. When teachers finish university, gain their degree, in their first year they're called newly qualified teachers. Each NQT will be given a mentor whilst they're in their new job. It's usually for a year, just so that person can mentor them, give them advice and support whilst they work their way through their first year as a teacher. Professionals and practitioners. A wide range of professionals and practitioners work in health and social care and childcare, such as nurses, dietitians, therapists, psychologists, psychiatrists, and social workers. Practitioners can be identified as specialist fields or professionals professions, for example, medical, nursing and allied health. Task 3. Here you will be expected to pause the PowerPoint and research the roles and responsibilities of the following professions: nurses, dietitians, therapists, psychologists, psychiatrists and social workers. So the roles and responsibilities of these professions. So an allied health care professional, they are professionals different or distinct from dentistry, nursing, medicine and pharmacy. They include jobs like dietitians, therapists and speech and language therapists. They work with health and social care professionals and practitioners. Examples of healthcare professionals can be seen below. You could have dietitians, chiropodists, occupational therapists, osteopaths, paramedics, physiotherapists, radiographers. These are some examples of allied healthcare professionals. Standards for allied health professionals. There are standards in place to make sure health and social care and childcare professionals are carrying out their work duties and responsibilities to a high level and consistently, and include guidelines, values and principles that are relevant to health and social care professionals' working practices. In 2015, the Care Certificate was brought in, and it's a set of standards for those that work in health and social care. The Care Certificate provides workers with guidance on the required skills, knowledge and behaviours that are required for compassionate, safe and high quality support. Task 4. This is your opportunity to pause the PowerPoint yet again and undertake some research to find out about the 15 standards of the Care Certificate. So you're going to find out which each one is and a little bit of information about each 15. Identify the reasons why the Care Certificate was developed for health and social care workers. Once you've completed this task, you can send that to your teacher. Each standard is underpinned by full learning outcomes and assessment criteria. The 15 standards in the Care Certificate are: understand your role, duty of care, work in a person-centred way, privacy and dignity, awareness of mental health, dementia and learning disability, safeguarding adults, basic life support, handling information, your personal development, equality and diversity, communication, fluids and nutrition, safeguarding children, health and safety, and infection prevention and control. Due to poor working practices identified in the Mid Staffordshire Trust, the Care Certificate was developed. The Care Certificate is for healthcare assistants and care workers that don't have to go to university to undertake a full degree in caring within their role. And it's an identified set of standards. It's designed, I said, for the non-regulated workforce in mind, such as healthcare assistants and care workers. And it gives everyone the confidence that health and care professionals have the same introductory skills, knowledge and behaviours to provide compassionate, safe and high quality care and support in their own particular workplace setting. If you found this PowerPoint useful, please subscribe to my channel. This has only been completed for my classes just to help them revise or recap for their assignments, but if it can help others, that's brilliant. Any feedback's also appreciated. For example, anything I'm doing well, anything that could be improved. I'm adding daily new PowerPoints for different units as well. So if you subscribe, you'll get to know which ones are coming out and when. Thank you.